ready.
Looking at the fetal skull or juvenile skull, this is the anterior fontanelle. This is the posterior fontanelle. Laterally, we see the sphenoidal fontanelle and the mastoid fontanelle. One more time, anterior, posterior, sphenoidal, mastoid. Looking at these sutures, remember sutures are stitch-like joints. Coronal suture, sagittal suture, lambdoid suture, and then on laterally, the faint yellow line that represents the squamous suture. Cranial foramen. This is the carotid canal. Carotid canal, foramen magnum. This is the mastoid process, styloid process, occipital condyles, external occipital protuberance, hypoglossal canal tucked here. This is hypoglossal canal. Okay. Then we have foramen rotundum, ovale, spinosum. Remember R-O-S, R-O-S. Rotundum ovale spinosum. Lacerum. Optic canal is here. It comes through like this. The round one is optic canal. You also have a superior orbital fissure and an inferior orbital fissure. All right. Jugular foramen is this one right here. That's jugular. And supraorbital foramen here. This is a notch, but in some skulls you do see a foramen. Superior to the orbit, so supraorbital foramen. Inferior to the orbit, so this is infraorbital foramen. Mental foramen, you do see on the mandible. This tiny hole is mental foramen. All right, looking at the frontal bone now. Supraorbital foramen, then frontal sinus. Hold on. Okay, so this is the frontal sinus in the frontal bone, and this would be the sphenoidal sinus in the sphenoid bone. Okay, supraorbital margins are these. Superciliary arches are the brow lines, and then glabella, that's the center. Looking at the parietal bone, you have a superior what is that called, temporal line, and inferior temporal line. In some skulls they are really clear, in others they are not as much, so we will pick the one that clearly shows you for the exam. Okay, temporal bones, carotid, external auditory meatus, and then if you look through the skull, this is internal auditory meatus. So again, you have external auditory meatus, internal auditory meatus. The whole thing is petrous portion. Remember, the term petrous means mountain. Mastoid process, styloid process. Mastoid process is massive. Styloid process is pointy style. Zygomatic process of temporal bone right here. Then you have mandibular fossa, which is this depression. Occipital bone, we already talked about these. Foramen magnum, hypoglossal canal, jugular foramen. One more time. Occipital condyles are these bumps, and external occipital protuberance. All right, sphenoid bone. I already showed you these. Foramen lacerum, rotundum ovale spinosum, optic canal, superior fissures, these are done. Sphenoid sinus done. Oh, greater wing of sphenoid bone, lesser wing of sphenoid bone. hypophyseal fossa, and sella turcica. Hypophyseal fossa is the entire depression. The center point is sella turcica. Looking at this angle, these two are called pterygoid processes. This is the medial plate, this is the lateral plate, but together they form pterygoid processes. All right, looking at the ethmoid bone here, this is the cristigalli. The holes are called cribriform foramen. The plate is cribriform plate. The ethmoid bone is connected to the nasal cavity. This is the perpendicular plate. This is the middle nasal concha, which is part of the ethmoid bone, and this is the inferior nasal concha, which is a separate bone that is not part of the ethmoid bone. This is the vomer bone right here. Looking at the mandible, coronoid process, head. This is the mandibular notch, condylar process, ramus, angle, body, mental foramen, mental protuberance, and alveolar processes. And I think that's it. Hold on, two more. We have inferior nasal concha, I already showed you, lacrimal bones. So if you consider the nasal as the first one, so the second one is maxilla, the third one is lacrimal bone right here. Then nasal bone is this one, and then vomer, this one. You also have hyoid bone, which is this one right here. The U-shaped bone is hyoid. This is your atlas, the first cervical vertebrae. If you notice these facets, this is where the occipital condyle actually fits in and helps you rotate the head. And it also has this transverse foramen that shows it's a typical cervical vertebrae as well. But this is the first cervical vertebrae. Second cervical vertebrae, you have this pointy part sticking out, that's dens. And hold on. Typical lumbar vertebrae, as you can see, the spinous process is flat, blunt. It has a huge body, very typical lumbar. Looking at a thoracic vertebrae, it looks like a giraffe, as you can see, head of a giraffe. This is the pointy spinous process that comes down, and you also see the foramen here. Typical cervical vertebrae, the easiest way to identify is you see the transverse foramina, which you don't see in any other type of vertebrae. Looking at the spinous process, it's bifurcated. This is not a good one. There are other cervical vertebrae where you can see the spinous process actually bifurcating like that. Looking at the ethmoid bone, disarticulated. Superiorly, this forms cristigalli. These are the cribriform foramina, cribriform plate. This is the perpendicular plate. This is the superior nasal concha. This forms the middle nasal concha. Remember, inferior nasal concha is a separate bone. Looking at this sphenoid bone, greater wing, lesser wing, hypophyseal fossa, sella turcica, foramen rotundum, ovale, spinosum, superior orbital fissure, optic canal, as you can see. These are the pterygoid processes. We also have a medial plate and a lateral plate. The end. Okay.